Thomas Green here with the Peaceful Parenting Podcast. On the episode today, we have Jake Morgan. Hello, Jake.
Hello.
And a special guest by the name of Dawn Friedman. Dawn, welcome.
Hi, nice to be here.
It is nice to have you. Would you like to take a moment and tell the audience a bit about yourself and what you do?
Yeah, I am a therapist in private practice in Columbus, Ohio, in the United States. And I also run a course membership site for parents of kids with anxiety.
Well, in preparation for the episode, you've got so much experience on this topic. So I'm very much interested. I'm hoping I can do justice to by asking some good questions, because I think very, very knowledgeable on the topic. So happy to have you. I think it's good to start with definition of terms so that we're all on the same page. What would you say it means for a child to have anxiety issues?
Well, and that's a good question because, of course, lots of kids have anxiety, but not every kid with anxiety has clinical levels of anxiety. But basically, it becomes a concern whether or not they meet criteria for a diagnosis if the anxiety is getting in the way of their functioning. So if they're not getting to do the things that they like to do, and importantly, if you are not getting the things that you like to do as a parent because your child's anxiety is getting in the way.
Really interesting what you've just said. Could you sort of give a little bit more clarity about what that might mean in terms of getting in the way?
Sure. So what I tell people often that the parents bring kids to me either because the child has anxiety or behavior issues. And the vast majority of the time, the child with behavior issues is actually having anxiety, and it's manifesting as behavior issues. And a really common example are parents who are struggling with bedtime with older children. So they have an 8, 9, or 10-year-old who they still need to lie down with every night. They see this as the child is stalling about bedtime and is stalling about going to sleep. But actually, when we dig into it, it's often separation anxiety, where the child is struggling to let go of their parents' presence at this time when anxiety is higher. Because as adults, I'm sure you know, we go to bed and our minds start racing and we start worrying about tomorrow and we start thinking about everything we didn't get done and all the stupid things we said. Well, the same is true for kids, and they rely on their parents as a crutch to get them through that bedtime routine. So that would be an example.
Wow, that's a really good example. That makes complete sense to me. Yeah, that really does. Yeah, it's would you say there's more anxiety now amongst children than there was, or is that just a fallacy?
Well, I think that COVID has certainly amped up the anxiety. And part of that is because what we know helps with anxiety is exposure to the things that scare us. And so I've had a number of clients who were seeing me before COVID. And then when the lockdown started to happen, the kids started doing great because they weren't going to school in the same way, or they were getting to spend time with their parents. And now that we're bringing things back to normal, that anxiety is increasing. And then, of course, there are kids who have been so careful through COVID that now they're struggling with things opening up, like maybe being told, oh, you can take your mask off now, and they don't want to take their mask off. That doesn't feel safe to them. So I think it is increasing, but also our awareness of anxiety is increasing. And so it's getting diagnosed more because parents are aware, I think this might be a problem.
Have you noticed any trends in causes? So I know, generally speaking, you could have potentially hundreds of causes, but is there anything that really stands out for you in terms of the majority of the time?
Well, we know that the most common diagnoses in anxiety is generalized anxiety. This is for children, which is those kids who are just a little bit worried about everything. And then separation anxiety, letting go of their parents, worrying about their parents when their parents are away, worrying about their own safety when they're away from parents. And social anxiety as they get older and start worrying about their peer relationships. And then for younger children, especially, there's specific phobias, and those are kids who are afraid of thunderstorms and dogs and things like that. So I don't necessarily see that there are specific outside causes other than, like I said, COVID has amped things up, but the causes tend to be temperamental, and you can expose two kids to the same thing and one of them will develop anxiety and one won't. And that has to do with with temperament, really.
Mm. Yeah, I mean, I've got two daughters, 15 and 13, and their temperament they're completely different. So, I mean, they've got the same parents, they're being nurtured in the same environment, but yeah, they're very, very different. But I don't know, I mean, imagine they both have perhaps not clinical levels of anxiety, but they're obviously going to be anxious about certain things. Mm-hmm. But presumably what kids get anxious about varies depending on the age group as well, and who they're interacting with and what's expected, I guess, as you go up through the education system. Is that right? Is that fair?
Yeah, that is fair. And we do know that separation anxiety often becomes social anxiety. They can be two sides of the same coin for some kids. So if you have a child who is struggling to separate from their parents, I would kind of keep an eye out for the development of social anxiety, because we know that child does have a more anxious temperament and is very sensitive to the things that are around them. And there are certain environments that are better for certain temperaments than others. Some children do really well in a program that is very directive and very goal-oriented, and another child might really struggle in that kind of environment.
Generally speaking, because you mentioned some separation anxiety prior, and that parents can be maybe often the cause of anxiety, or at least maybe contributing to it. Is there some typical things that parents do to contribute towards making it worse?
Yes, and I do not like parent blame, so I'm really careful in talking about this, because as Jake said, you can parent two kids the same way and one will end up with some anxiety and the other will not. So let's be very clear, we are not blaming parents. Parents do not cause anxiety. That said, the research tells us that 95% of anxious kids have parents who are accommodating in a way that makes the anxiety worse. And this is a lot of this, there's a lot of research about it, but a lot of it goes back to Ellie Lebowitz out of the Yale Child Center, I think is the name. And he developed the SPACE program, which is where I got my training. And the SPACE program looks at the way that parents unintentionally perpetuate anxiety, because what happens is we have a child, for example, who might be afraid of dogs, and the child freaks out when they see a dog. And so the parent naturally starts avoiding situations where the child is going to get confronted by a dog. That makes perfect sense. It's good parenting most of the time to protect our children from the things that scare them. If a child is not likely to develop anxiety because they don't have that sort of anxious brain, then that avoidance it will sort of carry them through until they're ready to confront a dog. If they have an anxious brain and they go towards more avoidance, then they're going to keep avoiding dogs until you're having to go around the block instead of straight through because there's a dog in the front yard of one of those houses. And so I hope that makes sense, that good parents unintentionally exacerbate anxiety, but it's not their fault. Does that make sense?
Well,
yeah, it does to me.
Sorry, go on, Jake.
No, I was going to say, yeah, I think that does make sense. Yeah, that does. Go on.
What would you do in that example under both scenarios, using the dog example there?
Well, again, it's exposure. So that child is going to have to confront the dog in some way. And I'm not saying then you take a 3-year-old who's terrified of dogs and lock them in a room with a puppy, right? That would be terrible. But you have to teach that child how to cope with the anxiety of being confronted by a dog. And there are very specific ways to do that are specific to the child and the relationship and the situation. But the parents need to find ways to expose their child to the things that scare them and teach them how to cope with that uncomfortable, fearful feeling. And it might be that you say, we are going to walk by that house with the dog in the front, but you will hold my hand, or we will go across the street. And then eventually we'll walk by the dog. And And eventually, maybe we'll even stop and look at the dog, or maybe we'll find somebody with a super friendly, lazy old dog, and we'll go and pet that dog. So we're going to expose the child, because every time we help them avoid, we're telling them, you should be terrified. This is terrifying. You should avoid it. And that's not the message we want to send them.
Yeah, that makes sense. Actually, funnily enough, I have got the cutest little Cavalier King Charles Spaniel. So it's impossible for me to imagine this dog is frightening to anybody. And yet, when we go for walks down the street, you can see some people are visibly, especially children, small children. Most of them are like, "Oh, that dog's so cute. Can I stroke it?" But others are, obviously anxious and nervous around her. So yeah, it's clearly quite a prevalent thing, and there's no logic to it necessarily, because she's not a great big Rottweiler or a pit bull or something. She's a tiny, fluffy little friendly thing.
Yeah, exactly. You get exactly to the point, which is it probably does not make sense to us. But telling our children, that doesn't make sense. It's not like they're thinking with their logical brains when they're afraid. They're down in their brainstem saying, the dog will eat me, I must run. It doesn't make sense. It's just how they feel about it.
So correct me if I'm wrong, the last answer was exposure therapy. So just gradual, introducing it gradually where it's completely safe and they wouldn't feel, let's say like a picture of a dog, for example. And then the rest would be your example. But regarding maybe things which, let's say, are maybe a little less easy to quantify, like, I don't know, going into school or something like that. Have you got any thoughts there?
Well, so what we know is the research tells us it's exposure, but also CBT. And those are the two forms of therapy that are most helpful in anxiety. Now, your child does not have to be in therapy, does not need to have a clinical diagnosis for you to access these tools, because obviously a lot of exposure is not going to happen in the therapy room. It's going to happen out in the world. Well, the same thing is with CBT, which is cognitive behavioral therapy. And that's really teaching us how to recognize our thoughts, our cognitive distortions, which are our mistaken ideas like the dog will eat me, and instead saying, Jake's dog is very unlikely to eat me. Jake's dog has not eaten people so far and is very sweet and kind. And I recognize this as a cognitive distortion. And then also, when we are anxious, our bodies immediately respond. Our bodies, way before our thoughts, are saying, you're in danger, run from Jake's dog. And so we need to learn to calm our bodies. So our bodies tell our minds, hey, it's actually safe. And then our mind is able to go, oh, hey, body, we are safe. It's this circular thing. So we need to teach children how to regulate their emotions. And we need to do that when they're not freaking out. We need to have them build those regulation muscles before they're ever confronted by the things that make them anxious. So the child who's worried about going to school, maybe we start working on some mindfulness, maybe some meditation, maybe learning how to soothe our bodies. Maybe if they're worried because they're going to be presenting at school, we say, why don't you wear your extra comfy soft shirt? Or is there a worry stone you can carry, something that will calm you and ground you to help you go in? So it's twofold. It's the exposure, but also learning to regulate and calm our bodies so that our brains can do some higher order thinking about how scary things really are.
Would you say it's any different for things which perhaps are justifiably scary? So an example might be bullying, for example. So you don't necessarily want to expose your child to more bullying, and it's completely reasonable to be afraid of such things. But have you got anything to note there?
Well, that is a really, really great point. And because we do want our kids to tune into what might be actually dangerous. And that's part of what that higher level thinking allows us to do is there really reason to be afraid? So for example, the child who's afraid to go to school, even though the adults are aware of the bullying and are keeping an eye on the bully, it would make sense the child is still working with fear, but we would want to talk to them about the ways that they are safe. If they are not safe, then their anxiety is justified which makes it no longer an anxiety issue. It makes it a safety issue. Parents can get confused about that because sometimes we think the child's fearful reaction is harming them. And so then we get anxious about their anxious reaction. So it gets very meta. So the child who is now safe from bullying, and we're still hung up on their what was an appropriate fearful reaction, but is now no longer appropriate, but we have trouble helping them push through that, if that makes sense.
I guess it's kind of difficult sometimes to identify if one is one thing or the other as well.
Absolutely. And again, I'm not parent blaming, but we are meant to catch anxiety, right? I always tell people, if we were gazelles at the watering hole and one gazelle spotted a lion and starts to get nervous, the whole herd runs. We've seen that happen. And so we catch our child's anxiety, but they catch ours. And so if we're not clear about this, we may need someone outside of the situation to help us tease out what's happening there.
Earlier on, you mentioned the anxious brain. And so in an example with my two daughters, they've got two different characteristics and they kind of react in different ways to the same stimulus in the same environment. Is there an anxious brain? Is there something that we should be looking out for? And if that's the case, I guess part two of the question is, what should we be doing to try and help them and to sort of alleviate that anxiety at an early stage?
Yes, there is an anxious brain. And obviously these are general and it's very individual, but generally speaking, the temperament traits would be high sensitivity. Some of us are more sensitive to things than others. We're more tuned into our environment. We might be a little more put off by things like buzzing fluorescent lights may amp us up a little bit and make us more vulnerable to feelings of anxiety. So high sensitivity, high intensity. Some of us feel things more deeply. So again, our fear might feel more intense than somebody else's fear. We both might be afraid of dogs, but one of us can kind of cope and calm through it and the other one just goes straight with it. And then a really big thing is some of us have a more negative emotionality and it gets a bad rap. It's got the word negative in it. We see it negatively. But we want people with a negative emotionality because, for example, if you're a surgeon with a negative emotionality, you are more likely to check and make sure you didn't leave a sponge in somebody. So we want that. So we have children who they just have a bias towards seeing things in a more negative way. That's also sometimes called anger superiority. So some people with anxiety are more likely to interpret a neutral face as angry and are more likely to spot angry faces. Again, what a great quality. We need those people in the world. They help keep the rest of us safe, but it can get in the way. And so again, if we calm them, we help them calm their high sensitivity, their high intensity, so that they can step back and say, is my negative brain telling me the truth? For example, we're planning a picnic. It might rain. I'm going to pack the umbrella because I'm going to assume it's going to start rain. That's terrific. But if you can't get to sleep the night before because you're panicked about whether or not it's going to rain on your picnic, that is a problem. So helping them learn how to get this in a more reasonable way. I think those of us who are prone to anxiety, we have special gifts in the world. We are wonderful people. We just need help learning how to manage the reality of the world.
Yeah, that all makes sense. I like the idea that I guess that kind of someone who suffers from anxiety is, yeah, like you painted a picture of maybe in my mind a natural guard or a guardian, and they take on the responsibility subconsciously or consciously of watching out for everybody and making sure that everyone's okay. And I personally suffer from, I'm not naturally an anxious person, but there are certain things that obviously trigger a response in me. And as my daughters get older, I've become, when they were younger, I was always a little bit paranoid that there are pedophiles everywhere. And now that they're older, obviously they go out and they do things and they're not, I don't know if they're okay. I don't know. where they are, and I have to resist the urge to call them all the time and just check that they're safe. So
oh, I hear you. I think in order to be a happy, healthy parent, we have to live in a little bit of denial of how scary it is to be a parent, for sure.
Yeah, because obviously I want them to develop and understand and be capable of looking after themselves in this big world of ours. But at the same time, oops, sorry, darkness. At the same time, I don't want, I don't want anything horrible to happen to them. So I think presumably I can and probably am projecting some of that anxiety onto them as well. As you said, anxiety it can be kind of infectious. So,
yes.
So there might be something as a parent that we can do, recognizing that ourselves, I guess, to help our kids.
Well, it's exactly the same thing where we need to learn how to calm our bodies and do a reality check. So I get so many parents who have a 10-year-old who's still sleeping with them every night, and the parents want them out of the bed. They really want to sleep by themselves. And I have no opinions about co-sleeping. If it's working for a family, that's wonderful. But if it's not working for the family, they deserve a good night's sleep. But the child does not want this to happen and is going to flip out and scream and throw a fit, not because they're selfish, not because they're spoiled, but because they're afraid. And the parents, they are afraid of their child's fear. They're afraid of their child's behavior. And then everybody is trapped in that anxiety. So we have to work with the parents. I can't go to a 10-year-old and say, your parents would like you to behave now, please do it. And they go, wow, I never thought of that. My parents didn't share it to me in a way that you have, Dawn, that now I'm absolutely motivated to give up something I enjoy. No, we have to work with the parents. They're going to have to be the ones who make the change. It's really difficult stuff.
In terms of the first few steps, let's say you have a scenario where I think the word you used was whether they're functioning. It stops you from functioning, I think, were your words. So you're like, okay, a line has been crossed here. It's no longer a healthy, logical way to react. Of all the things that you've talked about, what would be the first few steps that parent should do?
Well, first of all, the parent has to recognize that they have created accommodations. Again, this is not about blame. This is about recognizing I created accommodations that made sense when I chose to make them, and they no longer make sense. So we're not going to beat up parents for doing things that got them through the day. We're just going to recognize, okay, you're tired of this accommodation, or your child is tired of this accommodation, which tells me it's time to let this accommodation go. And so identifying the thing that they're going to do differently. And I'm not saying blow up everything for this child. A child with separation anxiety, you're going to decide perhaps I'm going to move them out of my bed, or very often it's I want to be able to take a shower with the door closed. So we're going to start with this very small thing, and the parent is going to have to choose it. And then we're going to dial down to exactly how they're going to handle the inevitable fallout. And we're going to play worst case scenario, like the child's going to take the door off the hinges to get to you. Now that's unlikely, but we're going to plan for it, because that's a little bit of exposure therapy that we're saying to the parent. So the worst case scenario happens. How would you like to handle it? And that makes it easier to problem solve, because we go from the worst case scenario to more likely scenarios. And then once the child has been able to do this thing, even if they're sitting outside the door sobbing the entire time, we're still going to praise the heck out of them. They did it. They let you take a shower in privacy. This is amazing. The parent is amazing. The child is amazing. And then we're going to build on those mad skills those people brought to this very difficult situation. It is slow going, but we build on what we're doing at every step of the way, and so much encouragement for everybody. This is really, really hard stuff.
So in that instance, it would be a lot of positive reinforcement regarding the first step of exposing them to essentially the first micro step to the macro goal, if you like.
Yes, because the child then starts thinking of themselves as somebody who can handle hard things. And importantly, the parent starts to see that the child can handle it and that they can handle the child's dysregulation. So the plans we might make is parent, I know you're not going to be able to take a shower because you're going to be nervous the whole time, but you're going to pretend, and we're going to set a timer for how long you're going to be in there. And maybe you're going to call a friend who's going to talk you down when you're sweating and trying not to cry yourself because your child is so upset.
Interesting. Jake, did you have any follow-up?
No, I think that all makes sense. I'm just curious to know if there are different types of anxiety, and because in my mind, anxiety is kind of one thing, but you mentioned clinical levels, so I guess it's a sliding scale. But are there any particular different reaction types that are sort of grouped in?
Well,
with anxiety?
Again, so there's separation anxiety and there's social anxiety, generalized anxiety. There's panic disorder. We're familiar with panic attacks. And in children, we often are seeing that more as just somatic symptoms. So stomach aches, headaches, shaky legs, your voice shaking, breath coming fast. Kids who experience anxiety very somatically like this may be more prone to developing a panic disorder later. And even young children can have panic attacks where they feel like they can't breathe, they can't catch their breath. I've had young children tell me they feel like they're going crazy, and or even they're afraid of having a heart attack like an adult. And what they're really describing is panic disorder. There's also perfectionism can be a sign of generalized anxiety or social anxiety, children who are really concerned about what teachers think of them. I always ask parents as a screening tool is, do your children erase holes into paper, or do they crumple everything up? It's not good enough. And very often parents go, well, I do that. I don't know that's a problem, because perfectionistic anxiety, which is not a clinical term, but is really rewarded culturally. And so we often have kids with very severe levels of anxiety, but their functioning seems very high. They're getting wonderful grades. They're very accomplished. They often have type A parents too, and nobody has recognized that everybody is struggling with anxiety. So they're very accomplished and things seem to be functioning very well, but everybody has headaches and stomach aches all the time, and nobody's very happy.
What percentage of people would you say suffer from anxiety?
Oh my gosh, it's difficult to say. It's very difficult to say. For one thing, anxiety is normal. It's a normal emotion. It's a healthy emotion. We should be anxious. I was anxious about this podcast. I should be, because I care about doing a good job for you all. So that's appropriate anxiety. Now, if I was so anxious I didn't show up, that would be inappropriate anxiety. That would be taking my anxiety too far. So first of all, everybody has anxiety. The number of people who have clinical levels of anxiety, I'm trying to remember the last numbers I read. I think for one, it's very comorbid with other things like depression. Anxiety can drive depression. Depression can drive anxiety. And so those numbers are higher, people who are showing up for other clinical reasons. But I think the last number I saw is that 1 in 4 kids, is it 1 in 4? And I think that might be skewed by the pandemic too. I think those numbers are higher right now.
Wow, that's quite a high number.
It's more common than ADHD, but we hear about ADHD more. And I'll tell you, I get a lot of kids in my office that the parents are wondering about an ADHD diagnosis, and it's anxiety because they're very comorbid. It's hard to focus when you're scared.
Yeah, right. It's really difficult. Yeah, for sure. And to concentrate, and yeah, it kind of takes over your life, I think, and the lives of those around you, because one of my daughters, the younger one, is anxious about how she looks and how she's perceived. And I mean, she looks great, but I mean, it's not a logical response. It's I guess her fears that I don't even know where to begin with that one. But I guess that's quite a common one too.
It's very common. And there are certain ages that are more anxious, and certainly early teens, super anxious age. Absolutely.
Yeah. I mean, do you have any sort of magic bullets or anything that you could recommend to say to someone who's concerned, or not to say to someone who's concerned about their looks, for example?
Well, remember, it's not logical. And so telling her how beautiful she is, she's going to go, you're my father. What do you know? You know, let me give you all these examples of other people are prettier. Something I have found very helpful with children of every age is I will get out my child development books and point out to them that what they're going through is typical. And so I would tell her, listen, she's 13, right? You said she's 13.
Yeah.
And so I would say, 13 is an age where you are thinking more about your peers and more about things socially. And so it makes sense that you're getting your sea legs here. It is normal to feel insecure at this age. It's not actually who you are. You are very likely to grow out of it, and recognize that this usually has more to do with your social anxiety than actually you. So what I told my daughter, who's now 17, is there is not actually a perfect pair of jeans that will make you feel fantastic about yourself. You are meant to be sort of confused and struggling with identity. And it didn't actually make it go away, but it let her see that one day it would go away, that she was not trapped in this feeling forever.
Yeah, right. Because that's a horrible feeling that there's, you know, it's never going to get better. And yeah, that's a good point, because nothing ever lasts forever. So but emotions don't really understand that, do they? They're kind of
No.
more animalistic. They just kind of know the here and the now, and everything feels like it's colored by whatever emotion you have. And that's all it's ever been, and all it will ever be. So I always think that if you're upset about something now, or worried or angry, and you think back in the past, your brain focuses on all of the other things that made you upset or angry, or sort of in tune with the emotion. So it really is like having a pair of sunglasses and seeing everything through a colored lens.
So the other thing I'd recommend is that people go Google cognitive distortions, and that's part of CBT. They're also called thinking errors. And some people for younger children call them stinking thinking. But there's basically a list of really common cognitive distortions that when people look at, they go, oh, I do that. And you say, right, so feelings are not facts. The way you are feeling something does not actually mean that is true. Learning that it's a big skill. We still work on it as adults, but why not start working when you're younger? Maybe they'll be ahead of us and worry less when they're grown.
Yeah.
Is there anything that you'd like to mention on anxiety in children that we haven't asked you about today?
No, you guys are really good interviewers. This was great.
Jake, have you got anything you'd like to add?
Well, I'd like to say thank you very much. I'm not sure if we're really good interviewers, but it's a really interesting topic, and you clearly know your stuff, so it makes it a lot easier.
Well, I have loved talking to you both. You're just terrific.
Thank you, Dawn. You're a great guest. And where is the best place for people to find you?
You can find me at childanxietysupport.com, and on Instagram is Dawn Friedman, MSED.
Dawn Friedman, thank you very much.
Thank you.